Medical Dilemma.
Hello, we're back. My name is Harry Tambuatco. We have Dr. Tess Sanchez with me. We've got Father Jerry Manglangit. We've got Attorney Sarah Sugitan. That compromises the Medical Dilemma group. And our expert guest, we've got Dr. Jessica Abanyo. Doctora, you were going to the third slide when we cut you off and we were already discussing the many issues. Maybe we can go to that issue first, the third slide about the...
Macular degeneration.
Hindi ko po ma-pronounce yun kaya hindi ko sinasabi. Macular, parang... Okay.
Degeneration.
Okay. So before anything else, I guess I have to point where the anatomy of the macula is. So as I mentioned earlier, ito yung yellow part po, that's what we call the retina, or that's the film of the eye if we were to compare the eye to a camera. So it captures the image and brings it to the brain.
Excuse me, Doctor, when you say you're comparing it, the retina to a camera, what concept of the camera? The memory of, the ability to see something, to keep the memory of what you see. That's the retina.
Yung digicam.
Yes.
Parang digicam, yung
Yung
memory.
lumang camera.
Oh, yung lumang camera.
Kasi sa camera, di ba may lens siya?
Correct.
So this comprises of the lens.
Yes. Yung
The
nagkiklik.
real lens, this is the lens of the eye. Yan yung nagkaka-cataract. So pag nagka-cataract yan, parang may ulap or may shadow yung mata.
Nagdidilim.
So if you were to compare the eye to a camera, ito yung lens.
Shutter speed,
Yes,
kumbaga.
ito yung lens, ito yung back, yung retina, ito yung film.
Yun, that's
So the retina captures the image, goes to the nerve, and brings it to the brain. So ito parang optical lang siya, lens. Parang lens ng camera.
okay.
So if you have any problem sa back part ng eye, your vision will be blurred.
Also at the back of the eye,
So,
not in
yes.
front of the glass
Okay,
portion.
yes. So this back part, this is what we call the macula, the center of the retina. It's the macula.
What is that made of? It looks like it's just basically skin with a lot of nerves going in and out.
Yes, the retina has the blood vessels, and then it has also some of the nerves.
But it's viscous, it's just a gelatic
Gel.
type, gelatic.
Hindi siya structure siya. It's a
Parang-
structure.
It's a structure talaga.
Yes, it's a
Gosh,
structure.
God is great, isn't He?
Yeah.
How
Yes.
the eye is made out of. How did you even get to study and master this? Ano ba yun? Binuksan
You have
niyo
to
yung mata?
slice.
Well, really, di ba? And science, look at it. This red one does the left foot, the blue one does the right foot. But go ahead.
For the retina, you have a retina specialist. I'm not a retina specialist, but I can talk about what we call macular degeneration.
His name is Steve Jobs, the specialist. Di ba? But go ahead, yes.
Yes. So the macula is the center part of the retina. So it is responsible for clear central vision. So usually, patients with macular degeneration have blurred center vision. So what happens in macular degeneration is actually yung mga byproducts ng metabolism ng retina na usually nalalabas ng eye in a normal way, hindi nalalabas. And what happens is these deposits, which we call drusen's, para siyang trash ng eye. Nagde-deposit siya inside the eye.
I think you have to turn it on.
Yes.
It went off. There.
Meron palang mga
Yeah,
ganun
may
sa
mga
mata, no?
password pa.
May
It's okay to
deposit.
turn it around.
Okay.
Father, earlier we were talking about the stem cell, and my perception of stem cell was the ability to get a substance or something that's in good condition, moving it from one part of your body. This is the minor stem cell. The other stem cell, the one that got popular as well, Gayon kay Enrile, where he got a goat or some animal in Germany or something, whatnot. But you have the minor stem cell, I know some doctors do that, where they take the fat from your body. In this case, I think I misunderstood it, Doctora, correct?
Yes.
Your stem cell concept was totally different.
Yes. It's an adult form of stem cell. There are different types of stem cell. One, pwedeng galing sa embryo. Yung embryo, yung stem cell ng embryo, that can regenerate to any type of our organ.
Tissue.
Pluripotent.
Yes,
They call-
pluripotent. And then if it's an adult
Miracle
stem
already.
cell, if it's an eye stem cell, yun lang yung mapoproduce niya.
Tsaka that came from the same person, the same body.
Not
Her
really.
her stem cell.
Yes.
For the eye.
Earlier, the example she was saying, it came from the same body, same person, you take it from one side, but because that eye was already defective.
Right.
Kumbaga, you took a spare part.
Yes.
Parang ganon. You took the interior tire, pero maandar pa rin yung gulong. Parang nilagay mo ngayon sa kabila para umandar. Yun, legal yun.
Yes, it's allowed.
Yeah,
because
of course,
because
it's
the
to yourself.
donor
The
is also
donors-
the donee. So the
Not
consent
only legal,
is...
it's also ethical.
It's ethical because it comes from your own body to repair your own body.
Well, because it's going to be very useful to the other eye, for that matter, and the other one it's
Already
already
done.
useless.
Can we go to another? Is there another slide you'd like
Yeah,
to bring us to?
the
Yes.
macular.
I think we lost the...
Yes, so this is,
No, we lost the picture again. Alam mo yan, ang
there,
naiiba kay
there.
Steve Jobs. Eh. There you go. Yun, we caught it already. We caught it. Doctor, you
Yeah.
can explain this. There we go.
so, yes, that is a photo of the retina. So, yung nasa center, yung may arrow, those are the deposits. We call it drusen.
The arrow, yes, the blue
Yes.
arrow now,
Yung
yes.
drusen na yan shouldn't be there. So, if you have those drusens, those are deposits of parang trash ng mata or byproducts of metabolism that causes blurred center vision.
Hindi
So,
mo
that's
pe-
what we call
You can
macular
take it out.
degeneration.
You can take
No,
this out.
you cannot take it out
Permanent
anymore. It's
already.
permanently
That's
there.
permanent.
Well, we,
Yeah.
A sign of aging.
Yeah, that's
my
degeneration from
That's a rule.
aging.
TV
also.
caught my mouth open, gaping open, look at it. Oh my God. Ang dami naman produkto ngayon sa market that they sell. Baka kaya na ayusin yan, yung mga red eye, mga eye mo, yung mga kung ano binibenta ngayon dyan na wellness, ano. Iyan po, huwag nyo gamitin, sabi ni Doktora.
Mga vitamins.
How are we
Not all
supposed to
of it.
handle that?
First of all, if ever you have eye problems o kahit anong sintomas na mayroon kayo sa mata, ang kailangan you have to consult your doctor.
But they're selling these products. Am I right, Father?
Right,
Over the counter
Binibenta
pa
nila.
yun.
It's
Right.
called wellness products.
Right.
Minamarket yan.
They even have stem cell capsules.
and that's the reason where you have some ethical issues there.
How come they're not being withdrawn, confiscated, but hindi inuhuli ng batas?
They can sell. There's no prohibition. Yung ano lang FDA regulation, meaning you have to guarantee whether it's safe for commercial consumption, for public consumption. Pero if efficacy or effectivity nung supplement is not
Iba.
it's not provided. Sometimes it's not even tested if I'm not mistaken. It just goes through the channels of trade. Tapos kung may complaint na lang, saka na lang nalalaman na nakapasok na pala sa merkado.
Pero that's
They're
unethical.
presented
That's
as
unethical,
supplements.
yes.
They're presented as
Oh,
supplements
exactly,
only.
Doctor.
That's the exact.
Sinasabi, what did they call that? May batas kasi, no approved therapeutical claims.
Yes.
Pero binibenta nila nonetheless. And poor Juan de la Cruz, okay sa mata ito kasi mahal ang doktor eh. Kukunin nga, di ba? May iba nga, ini-spray pa yung mata, sabi mo.
Yes.
So, hindi dapat po. Eh, yung
Dapat-
eye mo, di ba? That's, I think FDA yan, ang tagal na sa market yung eye mo. Meron pa yung red eye.
Yes.
Yung,
yes. Ang pinaka-important is these products can be harmful if they are not used properly. And if you don't have that tamang diagnosis, kailangan magkonsulta talaga sa doktor muna bago gumamit because this can have harmful effects as well.
Doktora, alam niyo naman today, it's called Dr. Google. Dr. Google tells you everything in your body and diagnoses everything, di ba?
And the audience thinks they understand already.
Oo, di
the
ba?
situation.
Dr. Google, no. Put your head in the bathtub, only put one ice cube and just wait for 2 minutes and raise up and you'll be okay. And then you'll see people sticking their head in.
And sometimes even some doctors, we do not know these doctors, but they also even promote it. Even, for example, in advertisement. But you see, if you try to, let's say, prescribe, it's also ethical, or it should be part of the ethics of a doctor to see the patient. Not just to make prescription through the telephone or through the television. That's unethical.
Yeah, you really have to see the
But do you know
patient,
there are
examine.
new applications now? I've been approached for one just in the recent weeks. An application on the telephone where you can actually consult with the doctor because after all, the telephones today are smartphones. Oh, tingnan mo yung bukol ko po. Ito, ang mata ko, tingnan mo. Oh, yan. Oh, tingin mo, masama na ba mata ko? Ano kaya dyan? Doctor, you know.
May camera yung phone.
Kasi nag-uusap na kayo, consultation.
But you know,
So in other words, hindi
in the
dapat.
encounter between a doctor and a patient, you should not only see something in the picture, but the whole totality of the patient.
Dapat na.
Okay? Because there are things that probably you need to smell, even. You need to
The
hear.
other sense,
Yeah.
yes.
Yeah, other
Yes.
sense, yes.
Yes.
That's how
Touch.
good diagnosis should be. And that should be the ones that must be promoted by doctors.
I'd like to touch on one more ethical issue, if we can squeeze it in the last 4 minutes. Religion. How does religion come to play? You had a situation where you had a Muslim, for example, where Islam became a problem towards what? From one to another. Because in Islam, you can donate to your God, your chieftain, your sultan. I offer you my life, di ba? Alam mo naman, would you still operate pag ganun? Would you transplant? You will not.
As a doctor, we don't get donor who's still alive.
Talagang
Because,
period.
yes, because it will jeopardize or it will endanger that eye,
Even if religion allows it?
even if religion allows it.
I'm the
because my
caliphate in
religion doesn't allow
ISIS. You do this, hindi pwede gawin. Period.
I will not. Ako,
Even at the risk
person-
of life, ha? Kung minsan pinapatay sila kung ayaw nila gawin.
And
Sometimes,
that's,
di ba?
that very thing is unethical, really. Why should you be under pressure? It is supposed to be something that
Voluntary.
you should take it voluntarily with
Yes.
consent and everything. But you see, sometimes also, well, religion would come into play and even culture. For example, there is not much prevalence of organ transplantation, for example, in Japan, because that is something which is not a part of their culture. That's why there are some Japanese who are, well, liberal-minded, would go to other countries before they would even come to the Philippines to seek organ transplantation. But
Iba.
not there.
Iba na talaga ang mundo. It's 2015 and they're allowing gay marriage. So why not just transfer the eyes? We have the last 3 minutes. How about a quick message from you, Doctora, to our viewers before we part? A quick message.
Yes. For all the viewers, I will encourage, kung meron po kayong sintomas sa mata, ang pinakamabuti pa rin ay kumonsulta sa doktor nyo. Sa madami hong ophthalmologist around, meron ho kaming 1,500 ophthalmologists sa buong Pilipinas na ready to serve you. Most of the eye diseases, marami sa kanila are preventable and treatable when diagnosed early. So kung maaga pa lang at meron na po kayong sintomas sa mata, gaya ng paglabo, pagkakaroon ng pamumula o sakit sa mata, pwede ho kayong kumonsulta muna sa doktor bago ho kayo gumamit ng any produkto or any product na nandyan ho sa market. Hindi ho porke ginagamit ng artista, maganda ho sa mata.
Salamat po, Doktora. Akala ko po yung una, Kapampangan si Doktora, yung pala talaga yun ang pronunciation, ophthalmologist. Hindi Kapampangan. Kayo, ano po ang payo nyo, Attorney Sigitan?
Siguro dun sa last point na hindi na natin masyado na-discuss, a doctor can object to certain things. Like, we cannot force a doctor to do something for us. And in fact, we cannot force anyone to do anything for us kasi it's enshrined in our Constitution, yung no to slavery. So, that falls under that.
No, we can always go to Pakistan and have it done. Father Jerry?
Well, in my experience, we must always promote a thing about quality healthcare. And quality healthcare is always something which is efficacious, must be, of course, affordable, accessible, and the last would be, it has to be moral.
Gee, I'm not sure that sounds like Pinoy's government, but I'm going to try. Doktora Tess, ang dami ko pinapasok dito. This is not my show, it's Medical Dilemma.
Oh, it's all right.
Doktora?
Basta si Harry. Well, you know, the eye is one of the most important organs in our body. You know, if a person is blind, you can hardly be functional, right?
Right.
And so treat it as if it is really, it's really something that if you lose it, wala na. You lose your eyesight, how can you now be very functional?
We'd like to thank you. We are ending the program. Medical Dilemma comes to you in form of information education. So you need not be critical, but at least you need to understand the real issues that confront doctors, hospitals on a daily basis. It's not all that easy to make decisions. You've got the legal issues. I mean, do you need to be a lawyer to become that doctor, to operate, to become the ethicist, to become that Christian, that faith, that priest, and the general practitioner, as well as whatever? It's not all easy. The complexity of issues make us human, and we need each other and expertise to come across, to come about, to become and stay human. Well, that's enough. Maraming salamat po. My name's Harry Tumbuatco. I'm sitting in for Sunny Del Rosario. We hope you've enjoyed the show. We'll be back next week. Watch the replays. It comes on. Before anything else, one more time, thank you to the sponsors. You've got St. Clair's Medical Center. That's in Dian Street in Palanan, Makati. you've got Makati Medical Center, and you've got Life's Quest, a consultancy group. Maraming salamat po.
Very good.
Medical Dilemma